So tooth number 31, and I had to use a premolar clamp for it because tooth was prepped for a crown, had a temporary crown on it, and there was extra cement between number 30, stuck between number 30 and 31, and that bothered the heck out of me. So I removed the temporary crown to clean out the extra cement. So now, as you can see, if I went for a molar clamp, it wouldn't have grabbed the tooth. So I had to go to a premolar clamp. As you can see, it's a premolar clamp. And the premolar clamp is grabbing it really well. And I have a very stable rubber dam on. Alright, so here we go. No rubber dam, no root canal. Remember that. I think that was our record. Tooth number 31, so lower right second molar, and we did it in 20 minutes from start to finish. So I think that was my record for a molar case, for a molar tooth, 20 minutes. I think so. I don't know, maybe it wasn't, but 20 minutes. So that was the tooth that we finished in 20 minutes. Don't ever let your patient leave your office with this temporary, a temporary that looks like this with extra cement stuck between. Don't ever. Have more passion. Have more care more. Okay, so don't let your patient leave looking like this. This patient was referred to me for endodontic treatment of tooth number 31. As you can see, he had a cavity here on the mesial and occlusal. This was the radiograph the dentist sent us, and you can see the decay approximating the pulp of the tooth. So decay was removed and tooth was prepped for a crown, and patient had started to have all the signs and symptoms of irreversible pulpitis with acute apical periodontitis after that. So this is how we got the patient. So as you can see, temporary crown, ill-fitting temporary crown. This is all extra cement, and patient was very uncomfortable here. So we recommended, of course, endodontic treatment, and that's what we did today. I went ahead and popped off that temporary crown, cleaned out all this excess cement, and the gingival was just so inflamed here. Please don't let a patient leave your office with an ill-fitting temporary like this. Have more passion, care more. This is just not I don't recommend doing dentistry like that. It's just not acceptable. And here's the post-op. As you can see, everything went beautifully. Two mesial canals and one distal canal. Be really careful with these teeth and their proximity of the roots to the inferior alveolar nerve canal. But look at the mesials. Look at the curvature. Beautiful anatomy, beautiful curvature of the canals here. As you can see, everything went beautifully. I cleaned out all that excess cement as I went over, but didn't put that temporary crown back on. I wanted to let the gingiva to breathe. So temporary, referred the patient back to his dentist for the permanent restoration. But as you can see, our job is done. Everything went beautifully. Excellent.